Good evening, everyone, and welcome to RSSDI Diabetes Bytes. Well, one thing is for sure that we always underestimate the vulnerability of women with diabetes, especially to develop cardiovascular disease. And today we have the right panel of experts, all who have been women's health champions in their own right, who have come to discuss this very important matter with us. And September being Heart Awareness Month, and we also observe September 29th as the World Heart Day, we thought this would be just the right moment to kickstart another movement and take it forward in increasing our awareness of women's potential or vulnerability to develop cardiovascular disease, especially with diabetes. We may I introduce our panel for the evening. We have Dr. Usha Sriram, who's a consultant endocrinologist from the city of Chennai, and she's also the founder of Divas, a movement for women's health awareness and initiatives. Welcome, ma'am. And she has been very closely associated with the RSSDI task force as well, leading many activities from there. We also have with us Dr. Benny Neglur, who is a consultant physician diabetologist from Thane. And thank you, ma'am, for joining in all the way from Stockholm. She is the founder of WhatCon, yet another movement in women's health, increasing women's health and focus on women and diabetes. We I also welcome Dr. Lily Rodriguez, who is our president, our chairman elect for RSSDI Telangana. She's a consultant endocrinologist from the city of Hyderabad and very, very active in the RSSDI Women's Health Task Force as well. Welcome, ma'am. And we also have Dr. Shalini Jaggi, who should be joining in shortly. We welcome a very vibrant and very forthcoming guest, Miss Karuna Gopal, ma'am. And to introduce ma'am, she is a very, very important personality. Actually, she is the president of the Foundation for Futuristic Cities, an independent director of Engineers India Limited, national in charge of policy and research, BJP Women's Wing, and she has several other important feathers in her cap. So without much ado, I'm going to hand over the panel discussion to Ms. Gopal as well as Dr. Lily Rodriguez, ma'am, for taking this further and really guiding us all as to how do we take this forward and how do we get women to focus on these complications that can actually be prevented. Thank you so much.
At the outset, I would like to thank you and the RSSDA for giving a chance to the Women's Task Force of Diabetes in RSSDI. And today we thought we'll have it slightly different because most of the time the doctors, tend to talk, professional language, and then we try to talk to the rest of the professionals. So we thought we will have it differently this time, and we've invited Ms. Karuna Gopal, who is a very, very active activist, I should say, and then she has kindly consented to be part of this, and she will actually represent the people at the government as well as people at large, uh, the public at large, I mean, who would have questions that can be asked to the doctors like us, and we would be answering her questions in the best way we can, and try to improve the health situation of particularly of women with diabetes. And I invite Ms. Karuna Gopal to do the proceedings. Thank you.
Yeah, thank you very much, Dr. Lily, for this opportunity. In fact, for a long time, I have been wanting to discuss these aspects of women health, primarily because I have the responsibility of crafting women centric policies that will assure good health for women. And I'm really delighted to be here. So, as a little bit of a context, and what perhaps I'm expecting from you is if you look at our country, India is a very aspirational country today. I think across the world, India is being looked at a country that can set a direction for the world, and we are geopolitically exhibiting our strength. We wish to be, our Prime Minister thinks that we can be more than a $5 trillion economy very soon, but that can be propelled only by human beings because humans are our only capital assets in the country that we have. And we notice that the people in the performing ages between 20 and 50 are falling violently sick because of non-communicable diseases like cancer, diabetes, and cardiovascular disease. And recent reports are even more appalling, my dear doctors, that I I was given to understand that women seem to have a bigger incidence of cardiovascular disease, diabetes, and even cancer. I was given to understand that the presentation of the cardiovascular problem is not in the classic form. I was given to understand that the morbidity rates are high and the mortality rates are also high. So this is very disturbing. And today, when you open the newspaper, you find that India again tops the list of the countries in diabetes mellitus. So we've been historically called the diabetes capital. So today, looking at women and the NCDs, we have a panel that can answer some of the questions and lead the government to come out with certain policies that will help stabilize women's health. So this is my interest in interacting with senior doctors like you, who are also not only doctors but activists, trying to weave your artful solutions into bringing better quality of life for women. So let me start with a couple of questions that I have in mind, then we can keep it as a freewheeling discussion. So let me go to Dr. Usha Sriram. Ma'am, I was given to understand that women not only today have a higher incidence of cardiovascular disease and also diabetes, but they seem to be experiencing more complications. So, could you please elaborate on this?
Thank you, Ms. Gopal, for this, asking me this question. And also thanks RSSDI for, asking me to be part of the panel today. Very important question you have posed. So I hope you can hear me. Just to set the stage, women have a very unique life cycle, okay, which is entirely different, obviously from that of men. And this life cycle itself, pregnancy itself, also is a window to future chronic disease. So many complications and other things that happens during pregnancy also makes them more vulnerable for these non-communicable diseases we talked about. So that may be one, big reason. But be that as it may, the reason why women are emerging as this hugely vulnerable group, the lifetime risk of diabetes is higher in women, even though this women and men have the same amount of diabetes, more women are dying every year all across the globe, except I think North America. As far as heart disease, still men have more heart disease and more men die from heart disease. But the moment women have diabetes, their protection that they enjoy from the hormones they have is all gone, so they become extremely vulnerable. So therefore, somehow for us to work on preventing diabetes becomes extremely important. Women's roles in the society have changed. Globalization, urbanization are affecting women more. The more women are poor. Poverty itself now we know is a risk factor for NCDs, whether it's built environment or other challenges they have. So it's a whole bunch of things that is pushing them into this abyss called non-communicable disease, and it's also going to make them poorer because taking care of themselves, family with these health issues are going to push them further below poverty line. So, which is why I'm thrilled that a policymaker like you is, headlining this event today because we can discuss more about, what the government can do to get us out of this.
Yes, yes. So yeah, thank you for highlighting this. In fact, you brought out a very important point that most of the reports are saying that women in urban areas, mostly in cities, are vulnerable, and the percentage of cardiovascular disease and diabetes mellitus is very high. Whereas the rural counterparts, it is apparently men that seem to have the higher rates. And ma'am, you brought out another very important thing in terms of the poverty, disease, the vicious cycle. So, how disease causes poverty and how poverty causes disease. And this vicious cycle is something that we have to break. And as doctors, perhaps you can break. Now, let me ask a question to Dr. Benny. Ma'am, I heard you're joining us from Stockholm, and it's a
Yes, ma'am.
great, it's really great to have you join us from that many miles away. That shows your commitment and interest in the subject. So, why why is it that it's important to address the heart issues of women? Can you just throw a light on this? Because again, in the recent past, I was given to understand that increasing there is increasing evidence that women are succumbing to this, and one of the reports says that almost two-thirds of the incidence of cardiovascular disease and diabetes mellitus will be found in women, whereas men will be little over 50%. So, why is it so important to take care of women's? Can you just elaborate
Thank you.
on this?
Thank you very much, RSSDI. And ma'am, I'm so happy that you are with us in the crusade to help women's health. And yes, it's very critical that we understand cardiovascular disease in women because cardiovascular disease is the leading cause of death in women with diabetes. And what is more important is that it is happening at a younger age. As
Yeah.
you mentioned already, that between the age of 40 to 55, there are younger women dying in the very prime age when they are useful to society. And why this is happening is that there is a challenge in, first of all, recognition of heart disease in women. The symptoms are so vague that even the patient or the woman doesn't attribute it to the heart disease. And when they go to the doctor, even the doctor doesn't recognize it as a heart disease. So there are challenges in recognition compared to the classical chest pain that we see in the men. There are also problems with intervention. Women, as you know, have smaller coronary arteries compared to the men. And when you do an angiogram in them after they get chest pain, it doesn't show occlusion. It doesn't show a classical blockage as we
Mm,
see in the
mm,
epicardial arteries as is men. In women,
mm,
it's so diffuse that they are sent back saying that your coronaries are normal. I mean, why are you complaining of chest pain? It even in the WISE study, I mean, the Women's Health Initiative study, it was shown that 50% of the women are sent back and they continue to get chest pain. And therefore, it is kind of a neglect. Basically, awareness will help this get better. Besides that, the women's heart involvement in diabetes is more in the microcirculation compared to the men, which where the involvement is in the epicardial arteries. And because of the affection of the microcirculation, women tend to have a heart failure which is earlier than the men.
mm,
And so
mm,
when they do their echocardiogram, actually they have a different, I mean, the left ventricular ejection fraction, which is a measure of cardiac function, is normal. So again they are sent back saying that your heart is normal, because they have something known as preserved ejection fraction heart failure. So this is the difference, and therefore this is again neglected. Again, as Madam Usha said, that women have a life cycle, and so you see pregnancy itself is a risk factor in diabetes. GDM itself is a risk factor for cardiovascular disease. Future following the pregnancy, also premature menopause, which is becoming very common in our country. Our the Indian Menopausal Society has said that women attain menopause in India at the age between 42 to 46. But you see, we are seeing young premature menopause even after 35, and premature menopause predisposes them to cardiovascular disease. And so you see, there are so many of these causes. Also hypertension and complications in pregnancy. Women have more risk factors: preterm delivery, depression, and also autoimmune disease and problems with pregnancy. All these are additional risk factors compared to the standard risk factors that we see in women. And therefore, we should address, make people aware. And I'm so happy that this topic is taken today, and it should go forward this way. Thank you.
Yeah, thank you very much. I mean, this is really completely scary and highly enlightening, but very, very scary. There is no classic presentation, and the outcomes are poor, maybe because even the diagnostics to a large extent do not help women, it looks like. So I think you have really brought out those technicalities in identifying and staying aware. I think this really needs to be jotted down and spread quite aggressively, given the fact that women are they look normal, but they might be highly vulnerable. Thank you very much for your inputs. Now let me go to Dr. Lily. Um, Dr. Lily, we have heard a lot about the risk factors. I wish to hear from you also. What could be more risk factors for women that they're being victimized by these non-communicable diseases like diabetes and cardiovascular disease?
Yeah, thank you for that question, Ms. Karuna Gopal. Uh, as we have already, the two ladies before me, they have already enumerated many risk factors that are there in women. The fact that a girl child is born right from childhood, I think she is as compared to the boy child, I think a girl is poorly nourished. As the problem starts from there. So poor nourishment right from childhood, they become anemic, and then they, then the menarche starts, and during menarche, again that during that phase, she undergoes a lot of psychological factors which will affect her sometimes very negatively, and then she also has goes through that phase of fear from the opposite sex, I should say, and
Mm.
then that fear also affects the girl and the teenage girl and the girl that until her marriage also she goes through a lot of psychological stress which can affect her cardiovascular system as well. And then as she attains menarche, and then nowadays uh, the rate of PCOS has gone up tremendously in our country as well, and obesity being one of the most important factor in girls, their health goes down to so much that their pregnancy, their house, home life, their work life, everything gets affected because of this obesity and PCOS combination. And then they are also more at risk for diabetes because of the insulin resistance that happens because of obesity and PCOS as well. And then, as Dr. Usha and Dr. Bini also has suggested that uh, the pre menopause and during the menopause, intra-menopause, and just immediately after post-menopause. That is the time when a woman undergoes a lot of metabolic changes within her body, and that also, pushes them to also have diabetes and more cardiovascular. disease, and then we talked about the neglect that a woman undergoes, both emotional as well as health uh, healthcare neglect that happens, and this carries forward in her postmenopausal period as well. So even though a woman is more resilient in her response to the health issues, but health care for a woman is suffering a lot in our country, particularly in urban as well as rural. I think it is the same.
Yeah,
As far as the woman's health is concerned, woman health care is concerned.
absolutely, absolutely. Yeah, thanks for the insights, Dr. Millie. Um, you have given an extensive perspective on how women can be vulnerable right from her childhood to her postmenopausal stage. So now I realize why you are constantly wanting to educate people, wanting to bring everyone into this level of understanding that their health is important and prevention is very, very important. So thank you for the insights. Now we've been discussing a lot about cardiovascular disease, but we know that cardiovascular disease and diabetes mellitus are intractably linked. Wherever there is diabetes mellitus, you will definitely find cardiovascular disease. So, and as I mentioned right at the beginning, today's paper was very disappointing. India's incidence being very, very high. Let's talk a little bit about the diabetes part as well. So maybe I'd like to go back to Dr. Usha Sriram. Doctor, can you tell me if you think it is necessary to look at this whole diabetes mellitus to the lens, to the gender lens? Like in my work, I use a gender lens in everything, in city planning, in practically everything that we do. We'd like to look at things from a gender lens. So would you like to um, elaborate on that, please? Looking at diabetes mellitus through the lens of gender.
Thank you for asking me that question. This is like giving me the biggest Christmas present because this is the thing that I want to talk about. So all these years we have known as- that there's something going on, that why should women have more heart problem or stroke or depression or fractures or or even chronic kidney disease. And now, a couple of years ago, or in the recent past, we have known that women with diabetes have 27% more cancer
Hmm.
than women without. So,
Right.
one of the first things that I also want to say is, while men and women are equal, we are not the same. We have a
Absolutely.
completely different, biology, life cycle, our social determinants of health, behavior, experience. Everything is different. That's one thing that's really important. And then, like I said, this whole life cycle that includes the pregnancy and breastfeeding and puberty and menstruation, menopause. All of those things also have you know close links our health, in our metabolic health, so to speak. And all this translates then into complications like heart disease or stroke or cancer, obviously, which we have learned now. So, for till recently, we've been thinking diabetes is diabetes, men and women is the same thing, right? But after we have studied all this and learned even firsthand, whether it's Benny or Lily or myself, we've seen it in our patients that
Hmm.
diabetes is a very, and I use this analogy that if you think that diabetes in men is like an elephant, it's big, it's
It's
wild,
big. Seen.
women, it's a tiger. It's also a wild animal, but much more ferocious.
Hmm.
So if
Hmm.
you think of it like that, that's exactly how it behaves. That it behaves for some reason more aggressively and ferociously in women.
Hmm.
So
Hmm.
just want to say that um, I don't really. I think it's really important to look at everything through the gender lens, especially how we diet, how we treat, how we counsel them, how we take this woman through her entire journey of life, and then how we, nutrition. So one of the things that we haven't, touched upon yet is, unfortunately, being overweight is much more common in women, and
Yes.
underweight is also more common in women. Both
Mm.
of which also has implications for the, the birth weight of a baby also, which
Mm.
again has implications for
Again,
future.
of course.
So this, we have to work on women's, nutrition, her physical activity, mental stress, stress lowering, sleep, all of those things to also help with weight management. So gender lens is absolutely important, and Dr. Benny and I, we have also been working on, um, raising raising the flag on that even diabetes treatment has to be looked at through the gender lens, and it should
Yes.
be gender appropriate. Till now, it has not been. So
Mm.
I think you raise the most, vital issue of the day, hot button issue of the day. The moment we do a gender lens, they'll also look at us. See, till now they are looking at this whole thing as a, like a feminist issue.
Mm. Unfortunately.
Yes.
Unfortunately, it's not
Yeah.
feminist at all, and it's not a battle of the sexes. Men have a lot of diabetes, a lot of heart disease. We want them to be healthy also, but women have very unique, challenges that
Mm.
we need to address.
Yeah. Oh my God. This is another eye opener, and the analogy of an elephant and a tiger will stay etched in my mind. And I wish that this message goes out at large to people, and also maybe the medical fraternity itself. They may also would like to address, and treat patients differently, take women seriously, maybe counsel them differently, etc. So this is absolutely a scary yet important. So I think every bit of information we are getting today has to be documented and disseminated quite extensively. One is for awareness, and the other is for action. It could be policy intervention, it could be a community action, it could be a country being mobilized into preventive healthcare. I think we should do that. So now let me go to Dr. Benny. Dr. Benny, we heard a lot about the incidence of diabetes and CVD in women. Now, what could potentially be the symptoms of cardiovascular disease in a woman that has diabetes? Will there be any difference, or can you tell me if there's anything
Yes,
like that?
thank you so much. And this is the most important question of the day because we are addressing the population at large and besides the healthcare practitioners. And I want every woman and man to understand the symptoms of cardiac disease. You know, we are taught in medical school that heart disease is just chest pain there,
Mm,
substernal, it is so severe, it might radiate to the left arm, the classical symptom of myocardial infarct. But when women present with heart disease and diabetes, it does not follow this rule. Women have very vague symptoms. They can just
mm,
have, kind of giddiness, or they could have a shortness of breath, or they could just have lightheadedness, or they can have profuse sweating, or they can have just unexplained fatigue. And you see,
mm.
all these symptoms are so vague that
Vague.
nobody attributes it to heart disease. And this is the message I want to convey to everyone who's listening here, that symptoms can be different, they can be vague,
Yes.
they are non-classical, and therefore they have to be looked at objectively by taking the ECG, etc., and taken it very gravely. And ma'am already told you that it's like a tiger. I mean, even I like that word. And women have a very heterogenic dyslipidemia, and therefore there are so many ways of attending to this. There are screening tools which can be done earlier in women, and we can address this heart disease more efficiently today.
Yeah, I think the- I think these inputs really are very important, and we are perhaps at a juncture in our healthcare that we can still remedy some of those problems we have in the system. And I'm glad we are taking the discourse to this level where pointedly we are talking about what needs to be done and how it needs to be diagnosed and how women have to be aware of their vagueness, and their biology itself and their life cycle. Every little thing has been covered, and I'm really, really happy to be listening to this, because sometime in my life I would be able to steer some good policy intervention, which will help women in a big way, and maybe make you realize your own dreams also. So, ma'am, Dr. Lily, um, we spoke a lot about diabetes. Looks like prevention is the only answer. So, can it be prevented? How do we look at prevention? Can you just tell us how to go about?
Yes, thank you for that wonderful question, because prevention is the key forward. And unless we prevent, it's going to explode. And we have already reached the stage of explosion. So now, at least, we have to wake up and try to prevent for the future generation at least. So how do we prevent diabetes? Definitely, it is said that almost 80% of type 2 diabetes is preventable. And then, what is the road to prevent? It is the adoption of healthy lifestyle. By particularly about women, women are the most common. I mean, women are the most. I mean, they are very bad for looking after themselves, and they don't care about their own health and prevention of anything. So they care more about their children and their husbands and people who come to their homes. And this has to be changed by looking after themselves first. I always give this example of aircraft. When you enter an aircraft, the air hostess tells you that if there is a air pressure drop, you
Take
have to
care of yourself,
take care of yourself first and then the
then
neighborhood.
the child.
I always tell this to our patients, both men as well as women, women more so. So, what is the healthy lifestyle? It is eating healthy and then stopping. If nowadays women also smoke a lot and drink, particularly in urban areas, and there are in some areas of rural areas also women drink a lot and smoke a lot. So this has to be stopped. And then the exercise, which has to be regular, and then not being overweight. So these are there are studies done, and controlling these four factors or five factors, including alcohol regulation. This has helped a lot, particularly in women who have gestational diabetes. And then if they follow these after the gestational diabetes is over, then the chance of getting type 2 diabetes is prevented almost by 80-85% up to 10 15 years. But if they're careless, and then as it happens in our country, they think that the gestational diabetes particularly is just during the pregnancy and it is over. But it is the post gestational diabetes period after the delivery that is very, very important to prevent type 2 diabetes. Similarly, prevent obesity, prevent this our lifestyle, which is very, very sedentary nowadays. So I keep telling all the people who are software people, every 2 hours at least, you just keep walking in your when you're downloading something, at least you stand up and walk and do some exercise. So exercise, eating healthy, giving up smoking, and maintaining your healthy weight. These are the factors that have to be looked into, and these are the ways to prevent type 2 diabetes, and it can be prevented.
Yeah. Thank you. I think we kind of covered everything that needs to be covered, in the sense. First of all, we established the need and urgency to address these big problem that women today seem to have: the cardiovascular disease and the diabetes mellitus. Especially the percentage of women falling sick is increasing, and unfortunately, the younger people are succumbing to that. And we understood the etiology of the disease. We understood how it presents itself and how early it could start and how damaging it could be. So the cardiovascular disease, diabetes mellitus that we're talking about, NCD spectrum, can really not only disturb a person at an individual level, but at a community level and also at a country level. So the economic cost to the country is very high, especially as I started at the beginning that Prime Minister aspires to really usher India into the next orbit, and that is possible only when we all stay healthy, and that is possible only when we can prevent the disease, because as we know, the curative aspects of any disease is much more expensive, and our investments per se in healthcare are not as much as we desire them to be. So I think the prevention is very important, and that is possible only when awareness is brought in with people of long standing who have contributed to the healthcare with absolute commitment to women health. So today is actually an important day. It's not only the CVD month, but we from the policy team also are planning to initiate a small action, and for which I would require your support as well, and that is for women health. And I would like to ask all of you one common question. Is there anything at the top of your mind that comes as a policy initiative that government should do right away? What is it that the government has to do? Yes, Dr. Ushasri.
So, President Biden announced last week cancer moonshot. President John F. Kennedy, in the 1960, when he became president, announced something called as the moonshot, putting man on the moon. At that time, it seemed so aspirational, not possible, but he did do it, or it happened.
Yes.
So,
Yes.
so Biden last week has announced a cancer moonshot, meaning by 2050, no one will die of
Okay.
it, which means he's pouring resources. They are making it
Okay.
priority. So I want a diabetes moonshot from the prime minister.
Diabetes full shot. Oh, this is really good. I think we should make that happen. I think
And
I the more the number of voices, the more lobbying we do for a good cause, not to get a Padma Shri at an individual level, but for a good cause for the entirety of the country. I think the government will start infusing more funds into research, more funds into making that happen. So maybe let's keep that as a good intention from our side. Yeah, Dr. Lily.
Yeah, one of the areas that we can definitely enforce something is the schools. The school children, it should be mandatory for outdoor or indoor physical exercise in their curriculum. It has to be mandatory. If the schools do not have that facility, it should not happen. So that
Okay.
kind of policy, if it is made, children become more active, and then they have become just bookworms. They don't know anything about the world. They are not world wise at all. The children who come out of degree college, they don't know anything. That's
Yeah,
what we.
I, I think this has to be addressed innovatively, because
Yeah.
most children don't value just walking or running. They don't value it at all. So I remember in if you would be also following this in Japan, when they started this forest bathing. It started as actually a startup idea by a Japanese kid, and it became very popular. So someone has to really brand it, make it look very exciting and interesting. Then they get into these games. So we'll have to innovate at every stage, because today's kid has more expectations, is bored very easily, is addicted to the internet. So he's not a kid like how we grew up. So his requirements are different, and we need to address them in a different way, introduce it in a very interesting way that they actually start exercising. So thanks for the idea. I think we'll do it. Dr. Benny.
Yes, I think if I were you, the first thing I would do is, keep diabetes in the map of India, and the correct word would be media. Advertise it,
Hmm.
kind of say, use a celebrity to say, come on, let know your risk score of diabetes. For example, when we come for the conference, they have all these posters here, say, know
Hmm.
your risk score. And if your score is say 2 out of 5, you're likely to get diabetes. Similar, we have an Indian risk score, which I think Dr. Mohan has made that. And if you can just use the media, put posters everywhere saying that we need to curb diabetes and be healthy. Please know your risk score. If your risk score is so much, take go and screen yourself for that. I think
Hmm.
this will be a mass media thing.
Yeah,
Besides,
certainly.
of
I
course,
think
education, awareness, and all these
awareness.
things that we are doing on
Hmm.
Facebook, Instagram, all that,
Right.
it
Right.
social media is will make a big change.
Hmm. Hmm. Yeah, certainly. So I've taken adequate amount of notes, and I think we are kind of we are done with our time, if I'm not wrong. But I wish to also speak up a little in the sense that when I see the numbers in the year 2035, apparently there will be 600 million people who will be NCD compromised. Like, so they might have cardiovascular disease, they might have diabetes, but at least minimum 600 million. So when you visualize the 600 million, it is like two Americas. It is like the entire population of America doubled up. That is it. And from the India perspective, all the millions of people living in our cities take twice the number. So that many people will fall victims. So awareness is very important, because really the world has understood that when we have conquered the infectious diseases, we thought we moved to the non-communicable diseases. But today the infectious diseases are back on the prowl. Today we have again all those problems, and tuberculosis is again getting a lot of attention. So quickly, to address the NCDs, we need to have strategies, we need to have awareness, we need to have more commitment from the fraternity, and aggregate your inputs and aggregate your efforts. I have seen sporadic efforts from every practitioner in every city. I think if we can all come together and aggregate those efforts and move in a unified way, I think India will get some grip on this malicious spectrum disorder like the NCDs. So, is there anything that you would like to say more on the topic, or would you like to ask me something?